Chapter 22, Regulatory and Advisory Agencies. Regulatory and non-regulatory agencies. Regulatory agencies issue laws and regulations that mandate compliance. Non-regulatory agencies advise and issue recommendations. Professional associations and organizations, valuable resources for current infection control and other professional information. Many dental professionals choose to become members of their professional organizations. The ADA is a professional organization for dentists. The ADA periodically updates its infection control recommendations as new scientific information becomes available. The ADAA is the oldest, largest group that represents professional dental assistants. Members include clinical personnel who work chairside with the dentist, as well as the receptionist, office manager, and those working behind the scenes in the dental product sales, insurance, and education. ADHA is the National Professional Organization for Dental Hygienists. It provides members with professional support, educational programs, and opportunities to participate in the organization. State and local dental societies can help you comply with regulatory issues in your specific area. National, state, and local dental assisting societies can often answer questions and provide opportunities for continuing dental education. OSAP is a not-for-profit organization composed of dentists, hygienists, dental assistants, government representatives, dental manufacturers, university professors, researchers, and dental consultants. This organization is an excellent resource for information on infection control, injury prevention, and occupational health issues. Government agencies include Food and Drug Administration, Environmental Protection Agency, National Institutes of Health, National Institute of Dental and Craniofacial Research, National Institute for Occupational Safety and Health, Public Health Agency of Canada, Center for Disease Control and Prevention, Occupational Safety and Health Administration. Food and Drug Administration is a regulatory agency, part of the U.S. Department of Health and Human Services, and regulates the manufacture and labeling of medical devices, as well as antimicrobial hand washing products and mouth rinses. Environmental Protection Agency, or EPA, is a regulatory agency and ensures the safety and effectiveness of disinfectants, regulates discharge and final treatment of waste materials, as well as medical waste after it leaves the dental office. National Institute of Health, the primary federal agency for conducting and supporting medical research, translates research results into practice and communicates research findings to patients and their families, healthcare providers, and general public. National Institute of Dental and Craniofacial Research. Its mission is to promote the general health of the American people by improving their oral, dental, and craniofacial health. Through research and the training of researchers, the NIDCR promotes health, prevents diseases and pathologic conditions, and develops new diagnostic and therapeutic techniques. National Institute for Occupational Safety and Health does not have a regulatory authority, is responsible for conducting research and making recommendations for the prevention of work-related disease and injury. NIOSH makes recommendations and disseminates information on preventing workplace disease, injury, and disability. It provides training to professionals in the field for occupational safety and health. Public Health Agency of Canada, main Canadian federal agency responsible for public health, supports approximately 2,400 researchers and staff, as well as a wide variety of programs and services offered by both federal government and non-government agencies across Canada. CDC is non-regulatory. Role is to issue specific recommendations based on sound scientific evidence. Infection control procedures practiced in dentistry today are based on guidelines for infection control in dental healthcare settings issued by the CDC. Occupational Safety and Health Administration is a regulatory agency that protects workers against physical, chemical, and infectious hazards in the workplace. It establishes protective standards, enforces those standards, and offers technical assistance and consultation programs. Is a federal agency, but 22 states administer their own state-operated OSHA programs. State agencies may have more stringent rules. OSHA bloodborne pathogen standard is the most important infection control law in dentistry. It's designed to protect employees against occupational exposure to bloodborne pathogens such as hepatitis B, C, and HIV. Employees are recommended to protect their employees from exposure to blood and other potentially infectious materials in the workplace and provide proper care to the employee if an exposure should occur. The BBP applies to any type of facility in which employees might be exposed to blood and/or body fluids. OSHA requires that a copy of BBP be present in every dental office and clinic. Written control plan requires each office have a written exposure control plan and must clearly describe how office complies with the BBP standard. The OSHA BBP standard requires employees to categorize tasks and procedures during which an employee might experience occupational exposure. BBP defines an occupational exposure as any reasonably anticipated skin, eye, mucous membrane contact, or percutaneous injury with blood or any other potentially infectious material. Before an accident occurs, the BBP requires the employer have a written plan. This plan explains exactly what steps the employee must follow after exposure incident occurs and the type of medical follow-up that will be provided to the employee at no charge. The BBP standard requires the dentist and employer to provide training in the infection control procedures and safety issues to all personnel who may come in contact with blood, saliva, or contaminated instruments or surfaces. The employer must keep records of all training sessions, and the records must include the date of the session, the name of the presenter, the topic, and the name of all employees who attended. Hepatitis B immunization. OSHA requires the dentist to offer the hepatitis B vaccination series to all employees whose jobs include Category 1 and 2 tasks. The vaccine must be offered within 10 days of employment. The dentist and employer must obtain proof from the physician who administered the vaccination. Employees have the right to refuse the HPV vaccine. However, they must sign an informed refusal form that is kept on file in the office. Between 1 to 2 months after the series has been completed, a blood test should be performed to ensure that the individual has developed immunity. A physician should evaluate individuals who have not developed immunity to determine the need for an additional dose. Individuals who do not respond to the second 3-dose series of the vaccine should be consulted regarding their susceptibility to HPV infection and precautions to take. The dentist or employer must keep a confidential medical record for each employee. These records are confidential and must be stored in a locked file. Employers must keep these records for the duration of employment plus 30 years. OSHA Hazard Communication Program. Hazard Communication Standard requires employers to inform employees about identity and hazards of all chemicals in the workplace. They must identify by name all employees exposed to dangerous chemicals and must describe training, how chemicals are handled, information about all labeling and safety measures, and how to respond to chemical emergencies. Employee training is required when new employees are hired, when new chemical product is introduced, once a year for continuing employees, and the dentist must provide training and may have help from the dental assistant. Must include how to safely use the chemicals, understanding SDS, all safety practices and warnings, how to use required PPE, and safe handling and disposal.